the topic entitled Effects of Listening to Music in Patients with Heart Failure from Francesco Burrai from Italy. By the way, the presenter have 10 minutes. At 8 minutes, I'm going to show the yellow card here. This means you have 2 minutes left. And when I show the red card, you need to hit landing. Okay, the floor is yours, Francesco.
Thank you very much. Good evening. I thank the scientific committee for their interest in my scientific work. The title of my presentation is Beneficial Effects of Listening to Classical Music in Patients with Heart Failure. My credits, 4 first prizes for research in music medicine in Italy, adjunct professor of music medicine, University of Milan, Italy. Publications in music medicine published in international journals of impact factor. Music medicine RCT's principal investigator and study coordinator, programmer for applications in music medicine and virtual reality. This study was published on Journal of Cardiac Failure, impact factor 6.7. This is my conceptual framework on the psychoneuroimmunoendocrinological effects of listening to music in heart failure. Recorded music enters in auditory system, then the signal is elaborated by the central nervous system, autonomic nervous system, endocrine system, immune system, with circular interaction. This interaction produces cognitive effects, cardiovascular effects, endocrine and neurochemical effects, immunological system effects. In particular, relaxing and pleasant music acts as an activator of autonomic parasympathetic outflow and also attentive sympathetic outflow. 2. Psychological consequence of reduction in sympathetic activity is a reduction in HR and lower cardiac workload and an improved ventricular electrical stability. 3. The high frequency component of heart rate variability increases in power, indicating that parasympathetic flow is increased. 4. Psychological and autonomic changes while listening to music lead to reduction of both arterial blood pressure and HR. Reduction of the sympathetic activation by listening to relaxing music reduces the adverse effects of tachycardia and anxiety. 6. Listening to music reduces activity in many brain structures, including the amygdala, hippocampus, parahippocampal gyrus, and temporal lobes. This pattern, in turn, promotes reduction in cortisol levels, with beneficial effects in terms of physical and psychological stress. I composed some music for the study following this composition framework. This song, the name is Y. A composition from rhythm of life equals 2 actions. 2 vital actions equal systole and diastole. Rhythm of music for 2 vital actions, 2 half. BPM heart rate objective synchronization. First 4 measures 2 square sweet link to cardiovascular system. Same BPM, same rhythm, same dynamic objective synchronization. This is my composition framework for this study through my songs. Materials and methods. Study design, multicenter, longitudinal, randomized control trial. Allocation 1:1. Patient population 159 patients with heart failure, New York Heart Association, functional class 1, 2, and 3. Setting for cardiologic center in Italy. Data collection at baseline T0. After 30 days T1, after 60 days T2, and 19 days T3. And again after 6 months, P6 as follow-up. Impact of this study, this is the first randomized control trial in the world. Trial regime. Experimental group. Music group. Listening to recorded classical music. Dosage. at least once at any time during the day for a total of 30 minutes per day at least for 19 days. Where and how? Listen to music at home in a resting position, lying flat or sitting using MP3 player plus earphone. Patient adherence, 1 time week at home plus 1 time by telephone. Control group, patient receives standard HF treatment. This includes nursing and medical counseling, self-care education, and medication. This patient had not access to predefined playlists, but they were allowed to listen to music of their choice during the 3 months in the experimental period. Outcomes, primary outcome. HF specific quality of life, assessed with Minnesota Living with Her Fellow questionnaire, secondary outcomes, generic quality of life, measured with the 12-item short form health survey, sleep quality, measured with the Pittsburgh Sleep Quality Index, anxiety and depression, measured with the hospital anxiety and depression scale, cognition, measured with the Montreal Cognitive Assessment. Playlist, a player plus response plus display. Audio format, MP3 at 16-bit 44 kHz, music pieces, 18 pieces, randomized listing, and all manual choice. Type of music, classical music, and most all know. Musical features, relaxing, pleasant, inspired by beauty, large, ethereal, transcendental, harmony, and sweet. Tonality, major keys in majority. No percussion. Find my concert at Bologna, Italy. Some music pieces from Debussy, Chopin, Fauré, Mozart, Bach, Einaudi, Italian composer, Haydn, Williams, Beethoven, Handel, and others. Changes in Minnesota Living with Her Fellow question scores. A is the total score of the questionnaire. B is the physical part of the score. C, the emotional part of the score. The following significant differences are shown in A, in music versus control in T3. The following significant differences are shown in B, in physical score, music versus control in T2 and in T3. In emotional score, the following significant differences are shown in C, in T1 and in T2. Changes in short form health service score. A is a physical component scores. B is the mental component scores. In A, no significant difference. In B, significant difference, music versus control in T1, T2, and T3. Changes in Montreal Cognitive Assessment score. Music versus control in T6. Changes in Pittsburgh Sleep Quality Index scores. Patients in music group reported lower scores with statistically significant differences at music versus control in T1 and T3. Changes in hospital anxiety and depression scale scores. The changes were more remarkable in the music group with statistically significant difference at, for anxiety, in T1, in T2, in T3, in music group. For depression, in music group, in T1, T2, and in T3. These are another my study. For example, in dialysis with RCT crossover study, in oncology with IRCT, in another dialysis with RCT with sax, in dialysis with a professional singer, in oncology and dialysis with a sax. I made another application also in pediatric ward, transfusion medicine, oncology ward, dialysis ward of these instruments: violin, guitar, flute, oboe, accordion, Celtic harp. This is my contact via mail, via YouTube, via Facebook, and via Spotify. And thank you very much for your attention.
Thank you very much, Professor. Nice presentation. Is there any
Thank you.
on the floor? We have time. You just stick to 10 minutes. We have 5 minutes for Q&A. So feel free if you have any question on the floor.